Associate Center, Dr. Sam Shatkin, is back with us because they're always doing more innovative things that can treat you non-surgically and have you look your best. So good morning and welcome back.
Hey, good morning, Linda.
And you are looking great.
We always have great things to talk about, but you know, I'm always trying to be timely and give you some of the newer things that are available in the industry, and we really have something really cool to talk about. I also want to mention about the non-invasive, includes Botox and fillers and various things like that. But let me start with this, okay? We've got this product we just introduced in our office. It's called Aqua Gold. It's hard to see, but this is a tiny little reservoir, and we can fill it with whatever we want. And in this reservoir, last week, my staff did on me, hyaluronic acid and Botox combination. And what it does is it reduces the pores, and it can actually help reduce some fine lines. So, you know, I'm always skeptical, but usually the staff, I'm the guinea pig, okay? So they did the treatment on me. You can see these are little gold, tiny little needles. I don't know if you know if we can get up real close to it.
Okay, very
Tiny little gold needles. They're hollow needles. So whatever's in the reservoir will be introduced into the skin. So you can add anything. You can add vitamin C, you can add brightening solutions. In my case, they did hyaluronic acid along with Botox. So essentially what we did was we filled the reservoir up, and then I've got a nice video here. I'm going to show you that next. And this is really pretty cool.
I like how you're always willing to use yourself.
Well,
I think that's very brave.
Well, look, I want to look my best too, because that's important, and especially I'm looking my best here. Let's see which camera you got us on.
Hold it there.
So see if you can zoom right in there. Okay. So you can see the treatment being done here, and you can see how these little tiny little needles. And Linda, you asked me before the show how much discomfort. It's on a scale 1 to 10. It's probably a 1. You feel a little pinching, but nothing serious. It's like a chemical peel, and you do the little needling. And this was done exactly 1 week ago today when they did this treatment on me. And I will show some before and after pictures now. So let me just flip ahead here.
And here you were able to do your whole face.
Right. So let's see if we can zoom back in there. So this is the after picture. Oh, let's see. Got a little glare there. And then this is the before picture. So maybe if I can sort of zoom in a little bit. So what bothered me are these lines that you see, you know, around my eyes, you know, around the crow's feet in there. Thanks, Linda. And that bothered me a lot. Okay. So now with the picture today, I mean, you could watch me on television, but I took this picture this morning.
Wow.
Now see the lines are pretty much gone.
Yeah.
Now this is a temporary solution to help improve the quality of the skin. We do a lot to do more permanent, like lasers and treatments like this. But I think this is just amazing. And when I saw the results, for me, I had to bring it to you today.
And there are no lines around your eyes, and I'm looking at you in person.
Right. Well, so halfway through last week, I sent a picture to my physician's assistant because she did the treatment on me, and I said, "Take a look. I hardly see the wrinkles." And then a couple days later, they were almost gone, and I've gotten a lot of compliments too. And I'm not taking any credit for it. It's really just my PA did the work, but it's this device that implements this different solution that we can put into the skin and really get to where the lines are. And I really am very excited about it.
So it penetrates because those needles are very, very fine, but it's getting deeper than what you can do at home by putting something on the surface.
Right. It's a technique like microneedling, because it is microneedling, but instead of just doing the needles and stimulating the collagen, now we're doing the stimulating the collagen and introducing solution into the skin, and that's what creates that rejuvenation in addition to the dermal improvement. The dermal improvement, when we do microneedling, takes somewhere between 6 and 12 weeks to achieve. This was about 4 or 5 days.
Yeah.
So I think that's really fantastic. So people that have an event coming up, I had it 6 days after my treatment.
Amazing.
I was really excited for that, and there is basically no downtime.
And of course, you still have Sculpture, you still have the laser skin rejuvenation. And the whole idea is to start thinking, believe it or not, about the holidays and get in there now.
Well, we have to do that because what happens is people will say, "Oh, gee, I got to look good for my holiday party," and they'll always remember to schedule their hair styling and all that, but they forget that they can take care of their skin. And if you really want to get a boost to the way you look or the shape of your body, and you mentioned Linda the sculpture we do for body contouring. You need to consider doing that, and we have a sculpture event next month. It happens to be on October 2nd.
Okay,
so we hope everybody can come, but you can only come with RSVP, and we have only a few more slots left. So you see the numbers there. Maybe give us a call.
All right, Doc. Thanks.
A will is the least efficient way to